Thank you, David, and I also want to thank the organizers for inviting me to the Asian Racing Conference. Coming from the United States, it's not often that we get invited to participate in conferences with the Asian Racing Federation. I think these issues permeate all of our collective business and horse welfare concerns. As everyone knows, we had quite a difficult year last year at Santa Anita. And keep in mind, this is while we were doing many of the things that Kristen talked about with pre-race examinations, using equine injury database factors to determine which horses were at most risk for racing. We were still having many of the issues that are listed on this slide. So what happened? Quite frankly, we're not sure. We don't know. I don't know that we will ever know. Most horses have pre-existing conditions when they have catastrophic fatalities. We did have a significant weather pattern in the area. But at the end of the day, we had to act before we could identify exactly the reasons for what was happening. We could not sit by and allow more horses to suffer catastrophic breakdowns while we did nothing. So what did we do? Now, this slide lays out a lot of the things that we did, both in racing and training. And racing, we added to some of the things we were already doing, and training, we really started to take control of the training program. Most people in most countries, you don't have much control over what happens during training. So this was some area that we really made a lot of effort to change that. When we were talking about medications in racing, we changed to a 14-day stand down on any interarticular administration. So any time a horse had a joint injection, it was prohibited from racing for 14 days. And we also had an anti-stacking rule, so you couldn't use multiple corticosteroids in a single joint. We also now have a 30-day stand down if the fetlocks are injected. So if someone reports any injection with corticosteroids in the fetlock, the horse is ineligible for racing for 30 days. And we also have a 48-hour stand down for any non-steroidals, and only one can be administered within approximately a week of a race. And then the other thing we looked at was the use of the crop. The crop was one of the most divisive issues that we had to deal with in the race, in the time that we had these issues. Currently, there is a rule in the California Horse Racing Board's process that will allow for a total of 6 strikes, no more than 2 in a row, and all underhand. I'm not sure whether that rule will get passed, but that is the kind of limitations that are being discussed. And I'm sure there are those who would like to have gone further. There are those who would not like it to be so restrictive. In addition to Santa Anita's participation, we've also required the private veterinarians who treat racehorses on the backside of our racetracks to participate in the welfare and safety of these horses. What we found as we were going through this process is many of the veterinarians weren't actually seeing these horses, watching them jog, seeing whether they were lame, prior to them breaking down. We would get into a mortality review panel with the veterinarian, and they would say, well, I've never really seen this horse. So we actually require veterinarians to affirm that they have inspected and jogged the horse within the 3 days prior to entry, and that they are comfortable with this horse racing. I will tell you, we've gotten quite a bit of pushback from the veterinarians and their liability insurers on this, but we've stood very firm. And what I tell them, I practiced law for a while, and I said, there's no one stopping you from getting sued if a horse breaks down. What will help you is having good records of an examination where you can show that your professional opinion was that that horse was sound. I think that this has been very effective. I will say we would not be where we are today without the participation and the assistance of the private veterinarians at Santa Anita and our other tracks. I mean, we've really allowed them to practice medicine again, and I think they enjoy that. Additionally, we have what's called the Governor's Review Panel at Santa Anita. This is a panel of 2 stewards and 2 veterinarians who review the entries on a daily basis. They can scratch horses based on their presentation on paper. If they have an abnormal work pattern, if they have an abnormal race pattern, if they've been given medications within a specific time, like the corticosteroids within 14 days, they will be scratched outright. Additionally, there will be a set of horses that we are asked as the association veterinarians to examine and do a pre-race exam actually 3 to 4 days before they race. So that allows us to see them before they have any medication like bute or banamine on board. It allows us to see them when they aren't race ready. And we don't tell the trainers if we are going to examine their horse, we just show up. And usually we see between 1 and 5 scratches per day on the card based on this panel. These horses can go on the vet's list and will have to then work off and have a time to work observed by a veterinarian. They may have to have diagnostics in order to be able to come back to racing. The other, as I indicated before, the other area we really took control of was training. And this is an area I think that anyone who does not currently have control over this area, I urge you to consider this. We limit medications for works. So horses are not allowed to have non-steroidal anti-inflammatories within 48 hours of a work. We have limited intra-articular injections based on previous screening limits that were in place prior to the absolute stand down. So roughly 7 days prior to a work, a horse cannot have an intra-articular injection. And we also regulate local anesthetics, as in racing, so 72 hours, which is very similar to the European and international stand-down times. One of the things that became abundantly clear as we went through this, the public does not condone the use of the crop. I have talked to people internationally about this and often heard, well, our racing fans don't care. That is not the audience you need to consider when you are looking at the use of the crop. The racing fans are not the ones who are going to go to the legislature and try and shut down racing. The racing fans are not the ones who are going to be protesting at your tracks. But it is the general public, and the general public does not like the use of the crop. We have had many hearings in California, and I will tell you, the days that the crop is on the schedule or the agenda, there are news cameras. And those news cameras leave as soon as we've had the discussion about the crop. And so what we did, and what was within our power to do as Santa Anita Park and the Stronach Group, was to eliminate the use of the crop in training. If you have been to Santa Anita in the last 10 months, training is very quiet now. We don't have any complaints from exercise riders. Generally, they don't feel like they cannot, they're not safe. Some of them don't even carry a crop anymore to train. But we see that, and they are allowed to use it in the event of safety. But again, we just don't see it anymore. They've learned to use their hands, their weight, their feet to ride. In addition, we require the private veterinarians to participate in training. So if a horse is going to work at Santa Anita Park or Golden Gate Fields, the veterinarians are required to certify that those horses are sound and ready to work within 5 days of that work. And we do audit this. So we will call the veterinarian, and we have the right to call the veterinarian and ask for the records of this procedure and this process. And if they haven't done that, we will call the trainer in, and they will have a very uncomfortable meeting with us the first time, and then the second time, it will be more serious penalties. Often, if these exams are not done as required in racing, the horse will be scratched. It's been very effective, and we've gotten very good participation. But again, this gives the vets the idea to a better idea of what their horses look like too. We require registration for works. So 48 hours prior to a work, a trainer must send us a note by email, or they can drop it off in the racing office that says, I am planning to work X horse at Santa Anita. This starts an entire process from our side. We create a fake race, and we look at the protocols and the injury database factors for each horse. And we look at each horse and say, this horse has 2, 3, 4 risk factors. This horse has 1 or 2 risk factors. And based on those risk factors, we decide whether we're going to go and actually physically inspect that horse prior to it working. And this allows both our association and regulatory veterinarians an opportunity for intervention. The more interventions we can have with these horses, the more we understand our population, the more we understand our individual horses, and the better job we can do to protect them. So every day that we have training, which is 6 days a week, for those of you who don't understand, Santa Anita is an extremely busy track. We have over 400,000 trips every year with horses on our racetrack. It is probably the busiest in North America, if not one of the busiest tracks in the world. But we take the time to select a group of horses based on risk factors, based on previous history we have with these horses, and we look at those horses and do basically a pre-race inspection. And if we are not happy with how that looks during its pre-race inspection, it is not allowed to work. We deny the entry for work. It may be required to have a veterinary exam. It may be required to have diagnostics. But we can limit how that horse, or we may say this horse just needs to retire. I will say one of the things that we've really benefited from is a great relationship with our attending veterinarians. Oftentimes they will be the ones to come to us and say, we really need you to put this horse on your list of horses to look at. I'm concerned about this, and I can't get the trainer to move to actually do the diagnostics, but you can. So we really work hand in hand with our association, our attending veterinarians. We also have an increased veterinary presence on the racetrack. Every day we have at least 1 and usually 2 veterinarians watching training. They will watch horses warm up, watch them work, watch them cool down. If before a horse is scheduled to work or any horse on the track looks lame, we stop the horse, we identify it, we will prohibit it from working if it looks unsound. We will also then trigger an examination in its barn, so an inspection and a palpation of limbs and jogging in the barn area. And that can result in the horse going on the vet's list and being ineligible to work, train, or race. And it can be, again, we keep records of every horse that we flag on the track as being unsound, and then we use those as we evaluate horses for both racing and training. All of those records and information is available to the governor's panel as they make decisions on whether a horse should be allowed to race after it's entered. We also drug test in training. We test for not only illicit substances, but we test for compliance with our restrictions on non-steroidals, corticosteroids, local anesthetics. This is done by the CHRB, and compliance has been excellent. I mean, we really have gotten a lot of cooperation from trainers and their veterinarians in this regard. So has it worked? We've done a lot. I don't know which has been more effective, which has been less effective, but I can tell you I feel like this is working. If you look at our total fatalities for the first part of 2018-2019 meet, we had 23 fatalities and racing a race of 4 per 1,000 and training 0.9 per 1,000. With nearly twice as many trips after we reopened the track in April, we had half the number of fatalities. That is very powerful. We're not talking about, you know, we have fewer horses going, we have fewer trips, therefore we would naturally have fewer fatalities. Here we had twice as many trips and half the number of fatalities. So that translated into racing at a racing rate of 1.7 and 0.22 for works. Does this mean we're happy and this is where we're going to stop? Absolutely not. This is a start. This is where we start from, and now by measuring this and continuing to monitor this, our goal is to continuously improve. Our goal is, quite frankly, 0 fatalities. Is that ever achievable? I don't know. Probably not in my lifetime, but that is our goal, and that can be the only goal we have in racing. We're also seeing a decrease in the total number of fatalities year over year. January and February were particularly difficult months for us in 2019. There are the numbers for January and February of last year. We had 14 fatalities as of 2 days ago. This year we have 6. I would like to have fewer. I think this is a combination of doing many things. First of all, more contact with our horses, more information about our horses. We are being more aggressive about treating horses and actually fixing horses that could be pasture sound. Our benchmark is if a horse can be pasture sound, the surgery gets done. We have a surgeon on site. We've done a handful of surgeries in the last few months, and all of those horses are still alive because we did those surgeries. We've reduced Lasix with the ultimate goal of a phase out of Lasix. I know that's not very impressive for the international group, as you've all been there for a long time, but this is a very hard argument in the United States, and it's one that took us a long time to get to, but I think Santa Anita took the first step towards this, along with the California horsemen and the thoroughbred owners of California, and I think it will make a difference in moving this bar in the long term. We've invested also heavily in technology. We have the first of its kind standing PET scan. This allows us to detect molecular changes to the horse's sesamoids, which have never been able to be diagnosed before. So far, we've done, at least as of a few weeks ago, we'd done 17 scans in the first few weeks. We've gotten really good clinical correlation to the exams, and the trainers and vets actually are very appreciative of this. We also bought a standing MRI, or have installed a standing MRI. Again, this is soft tissue, bone bruising. The more technology, the more ways we have to identify and diagnose pre-existing injuries, the safer we can keep our horse population. And because both of these machines were purchased through donations by either the Stronach Group or Foundation, Southern California Equine Foundation, the cost is relatively minimal for horsemen, which makes it more accessible and makes horsemen more likely to use it. So we're going to continue to look for data, research, other ways. We're constantly trying to figure out ways to keep our horses safer. We're looking at additional diagnostic machines, and we're always trying to educate horsemen and trainers and ourselves. So why does this matter at your track? This is a Santa Anita problem. I hear that all the time as I go around the United States. This is not a US problem, this is a Santa Anita problem. This is not an international problem, this is a Santa Anita problem. We're all in the same boat. Horse racing is going to be judged by its lowest common denominator. One day we'll all be at the bottom end of the boat, some days we'll be at the top end of the boat, but we're all in the same boat. These are headlines I've pulled from across the world: Canada, Hong Kong, Australia, the United States. None of us are immune to this public pressure. We have to act now. If we don't start changing our ways, we will not have the opportunity to change because we will be gone. For us, it requires a substantial investment in horse welfare and safety. At each region we have tracks, and there are 4 of them. We will anticipate spending over $1 million in personnel, just having veterinarians on the grounds to look at horses. And equipment costs, you're looking at for that PET scan, a CT scan, the MRI, you're looking at $2 to $3 million of investment in the machines themselves, plus maintenance, plus training of people, plus having people to do those. And hardest of all is this doesn't necessarily come with an increased field size. We have actually seen a little bit of a decrease in our field size. In part, we have horses that would not make it at Santa Anita, so they go elsewhere. We have trainers who don't like the strictness of the new rules, so they go elsewhere. So for the short term, we feel like, and we're prepared to weather a small decrease in field size, which is what we have had. But if we don't make these investments, we won't be around. So we'll be at risk. Thank you very much for your time, and I'm happy to answer questions with the panel.